Hi, Georgina Jacobson here, and we are so excited to have the pleasure of our Mayor of Newport Beach on camera with us, Will O'Neill. And we just wanted to ask you some questions, like how are you dealing with this current situation?
Oh, well, thank you so much for asking. First off, my family's fine. My wife has been fantastic with our two young children. We've got a second grader and last year preschool. So it's been interesting doing distance learning with them. But my family is doing well. And I check in often on a lot of other families inside our community, and they check back in with us. And so I appreciate your asking. As you can see, I'm home. I know you are too. It is not remotely normal for what we are going through, but I've gotten pretty used to working from home now. And so I really do look forward to the time when we can be back together. But right now we are all safer at home.
Yes, exactly. And so I know you probably don't know the answer to this question, but what is kind of the timeline to get back to normal or the new normal? Restaurants opening, that sort of thing.
Well, we have, in the last month, we've seen our world turn upside down. So we in Newport Beach are doing something that our city for 100 years is built not to do, which is close down. It's to tell people to stay home, to not come and visit. And so the last month has been a whirlwind trying to figure out how to handle the business closures and seeing a lot of people out of work. We are seeing a lot of people, obviously all of our children are home. We are seeing a lot of seniors who normally would be at Oasis Senior Center home. And so we need to be paying a lot of attention to how to take care of the physical and mental issues that come along with all of the social isolation. And so there is a pent up feeling like we have done a pretty good job in the city and we ought to start looking at reopenings. And there is something to be said about that. We have seen a pretty solid flattening in Newport Beach over the last 2 weeks. Our confirmed case count has been in single digits, which is fantastic, and increases that is. When I talk to doctors at Hoag, they have told me that they have a potential capacity between their two Irvine and Newport Beach campuses of 475 beds. At no point during this entire process have they filled more than 25 of them. And they're averaging right around 10 beds right now in the last 2 weeks. So these are really good trends. Now, what the CDC and a lot of other people will tell you, especially at the state and county public health agencies, and the city is not a public health agency, so it is important for us to follow those guidance. They're telling us, look, it has worked and you do have the ability to reopen gradually, but you really shouldn't do it so fast that you have a second wave, the spiking. So what we are probably going to see in public space reopenings is the same thing we'll be seeing in business reopenings, which is we need to be continuing to practice social guidance. We need to continue to wash our hands a lot more. We need to not go to work when we're sick. We need to use Purell. And frankly, there are going to be situations where face masks need to become normal. And so where we have seen a lot of this playing out in terms of the angst is I think people really want to be outside right now. I think they have had a hard time being inside this much. And so Newport Beach has fought really hard to make sure that we are educating ourselves, educating our residents, and making sure our public spaces are open as much as possible that allow for social distancing. So yeah, we are, and that's a long way of answering our thought process, which is, yes, we do need to start seeing some reopenings. I expect them to be gradual, stepped up into situations. In terms of a timeline to get back to what we used to be even 6 weeks ago, I think that's going to take a long time. But in terms of gradual reopenings, that's probably weeks, not months. But in terms of a full reopening, that remains to be seen because we're still trying to grapple with what the testing and all of the epidemiology figures mean for policymakers and for our residents.
Right. Well, and I feel like we're so lucky because we are in Newport Beach and, the weather is nice. And so it's not a bad place to be at home or, going for a walk or that kind of thing. So we are really lucky. And then, so are there any tips that you would, want to let people know what they should be doing or, kind of how to help their mindset to get through this?
Yeah, there are a lot. The number one though is I strongly encourage you, take care of yourself and keep safe. So right now, the more you can take care of yourself and your family, the less the city needs to be worrying about a whole bunch of other factors. And so Number one is take care of yourself and make sure you're in a safe environment. And that includes the mental well-being. Pay attention to mental well-being. Unfortunately, across the area right now, we've seen in the Southland in Southern California, suicide prevention hotlines have spiked some 8,000% in some cases. We've seen domestic violence situations increase, according to our sheriff, by about 25%. And so right now, mental well-being and physical well-being are really important. And so at our level, at the policymaking level in the city, we need to be paying a lot of attention to a whole community health. And one of the ways we do that is we pay attention to what the guidance is from the state public health agencies and the county public health agencies. And we have a great partnership with HOPE. I can't stress that enough. And so when we're trying to take that guidance and then implement it, what we're doing is we're making sure we're allowing our residents as much as possible to take care of themselves. And that includes making sure that they go into safe environments at grocery stores and essential services operations, and also into public spaces. So really pay attention. And the other thing that would be really helpful at this time, pay attention to your neighbors too. It is a great time for kindness. And that goes, by the way, for social media too. There are a lot of people home right now with a lot of time on their hands and spending a lot of time on social media. I would suggest taking breaks, a lot of them, from that throughout the day. And that includes the news. So just as a side note, that is a great way of taking care of your own physical and mental well-being. Put your phone down, log off, and just spend some time either outdoors in an area where you can social distance or otherwise. But then maybe the last final point is hospitals are safe. We unfortunately are hearing a lot of stories of people refusing to go to hospitals for things they normally would go for because they're afraid of catching the coronavirus. I have spent a lot of time talking to health doctors, people that are just experts in their field, and they are telling me, and they're trying to get the community to know, if you would normally be going to the ER or normally be going to the hospital for something, still go. If you have chest pain, if you think you may have mini strokes, if you have a bunch of other issues that you normally would go for, still go. It is a safe place. Frankly, it's probably safer than going to the grocery stores right now. But don't die because of fear. That is the last thing we want as a community, is to instill that kind of message. So please do go to the hospitals if you feel, if you normally would.
That's so great. And you know what's really comforting, I think, for everybody is to hear from our leader, just kind of what's going on and from the horse's mouth, and know that we have great direction, and we really appreciate all that you're doing for us. And thank you so much for taking the time to talk with us today.
Well, I appreciate that. And just as a quick final note, I'll say, I'm not doing this one alone, not even remotely. I am surrounded by phenomenal people in our community, and especially in our city leadership. I will just say our city manager, our police chief, our fire chief, and all of our department heads, they've been at the city for a while. And so that has allowed for some pretty great, efficient responses. And so I just want to tell you, this one has been a whole community effort. And so you said earlier how lucky we are to be in Newport Beach. I can't even tell you how lucky I am to be mayor at a time of crisis surrounded by really great people. So I just wanted to make sure I pointed that out. And I am thankful for so much these days, even in a pretty cloudy environment.
That's wonderful. Thank you so much. We really appreciate you taking the time. Hope you have a great weekend.
Yeah, stay safe.